blood supply of the forelimb. So this is the medial aspect of the forelimb. This is the axillary artery. Okay, till here it's the axillary artery. The first branch is called the external thoracic artery, supplying the pectoral muscles. The second branch is a suprascapular artery, supplying the supraspinatus muscle, and it crosses in below the acromial process and also supplies to the infraspinatus muscle. Okay, this is a suprascapular artery. So these are two branches. So next branch is the subscapular artery. This has three branches. So first branch is the caudal circumflex humeral, which will supply the teres major, the deltoideus, and the triceps muscle. The caudal circumflex humeral. Then this is the thoracodorsal artery, supplying the latissimus dorsi. Thoracodorsal artery. This will after giving these two branches, it will continue as subscapular artery, supplying the subscapularis muscle. Sorry. Okay. As we know, this is the axillary artery. This is the subscapular artery having three branches. It continues as brachial artery. So first branch of the brachial artery is the cranial circumflex humeral, which will supply the biceps brachii and coracobrachialis. So biceps collateral cranial circumflex humeral artery will supply the biceps brachii and the coracobrachialis. So the next branch comes the deep brachial artery. This cut here. This will supply the triceps muscles. Then coming down, we'll have another branch called as a bicipital artery, which will supply the biceps brachii. This is the collateral ulnar artery, supplying all the flexor group of muscles. Okay. So after that, it will give a branch called as transverse cubital artery, supplying all the extensor group of muscles. And ulnaris lateralis, which is a flexor muscle. Okay, so the brachial artery, after giving the last branch of that is transverse cubital artery, it will continue as the median artery, also called as ulnar artery, median or ulnar. Okay, so the first branch here of the medial artery is the common interosseous artery, which will go inside the interosseous space of the radius and ulna, and it will continue on the dorsal aspect as the cranial interosseous artery. Next, the median artery will continue downwards to give a branch called as the radial artery. Okay, radial artery. So the radial artery, along with the cranial interosseous artery, which is a branch of here, the common interosseous artery, will form a branch. So before this, it will form a rete like this, a rete on the carpal joint. Now the radial artery along with the cranial interosseous artery will form an arch through which that is anastomosis, through which three other arteries originate like this. So 2, 3, 4. Okay, the radial nerve along with the radial artery along with the cranial interosseous artery, first it will form the dorsal carpal rete, and after that it forms an arch. So that arch is called as proximal deep palmar arch, because it is the proximal region and it is deep. So proximal deep palmar arch, through which three arteries originate. They are called as palmar metacarpal arteries 2, 3 and 4. So palmar metacarpal artery 2, 3 and 4.
2 will not come, I think.
Okay. So the so as I told, proximal deep. So these radial artery and the cranial interosseous artery will form a arch. This arch is called as proximal deep palmar arch, through which three other arteries originate, called as proximal metacarpal arteries 2, 3 and 4. Proximal palmar metacarpal arteries 2, 3, 4. 2, 3 and 4. So all these will again anastomose to form another arch called as distal deep palmar arch. Okay, as this is distal deep, there is another arch called as distal superficial on the superficial side. So this is given by the medial artery. So the medial artery will give a branch like this to this distal deep palmar arch to form superficial arch. Okay, from this arch another two arteries originate. They are called as palmar common distal artery 4 and palmar common distal artery 2 and 4. Sorry, it is palmar common distal artery 3 and 4. So okay, the radial artery along its course will give rise to another artery called as Palmar common digital artery 2.